The inferior angle of the scapula, this kind of pointy bit at the bottom of the scapula, sorry to get technical, seems like it's devoid of attachment. Seems like it doesn't have anything that attaches to it. And this would very much be the exception in the scapula, because we have many attachments. Supraspinatus, for instance, the deltoid and its many points of attachment. We, of course, have our teres major muscle going around to the front, and we have a teres minor going more up to the top, and along with it a infraspinatus muscle. On the upper medial side, we've got a levator scapulae, which does exactly what you think it does, and then the rhomboid minor and the rhomboid major as well. And taking up a large proportion of space, we also have the trapezius muscle, which inserts onto the spine of the scapula. And then on that medial border as well, we could make mention of the serratus anterior, which is going to run around to ribs 1 to 8. But if there is a point, if there is a pointy bit, it must mean there is an angle of pull that creates that. Otherwise, it really wouldn't be there. That's how bone works. And so to answer why that's there, we have to introduce a relatively large muscle, the latissimus dorsi, which uses the tip of that scapula, the inferior angle, as one of its origins. Origins, by definition, are the unmoving part, whereas the humerus and the intertubercular groove, which it inserts into, is the more moving part. That's the definition. That's how we talk about that. Now, that being said, it implies something when you say that. So, for instance, the function of the lats is to pull the arm from an upward position, from an abducted and what would be considered flexed, as well as externally rotated, to take it from that position and do quite the opposite. So it brings it into adduction. It brings it into relative extension and then internal rotation at the same time, all in one very convenient movement. Now, were that the case, if it only did that, that would make some sense as to why we call this the origin, because it is making the scapula stay still and only this humerus bone is moving. If that were the case, that only makes sense in an isolated movement pattern. But it's very difficult to lift your arm up as high as this without the scapula going along with it. So that means the scapula has to follow along. So, therefore, when we bring our arm into this position, this lowered position by comparison, it must mean the scapula follows that motion down. And so this muscle tissue here, which is continuous with the rest of the lats, in any picture you can find, must shorten to accommodate that motion. That means, in a very simple way, that as the humerus comes into at least just adduction, it must also mean that the scapula drops down and into a medial position, what we might call retraction. And that makes a lot more sense. So what this actually means is that the lats attachments here, this lower tip attachment, seemingly unimportant, is neither really origin insertion, because it could be the origin if the arm is made to move in isolation, if the scapula is fixed in place and stopped from motion. But many times it is not, so it means that it is pulled upon by the rest of the tissue, and so it is now an insertion. And so it's really not origin, not insertion. And it's part of the reason why we're changing the definitions of origin insertion and why we're looking more at attachment points when we consider integrated biomechanics. And this is particularly important because if the shoulder, or if the scapula more specifically, is being held in a position that is medial or down, or some kind of a combined motion which causes what we call an inferior rotation, say this angle of pull, which pulls down here, it might not actually be the scapula's other attachment. And it might not be the shoulder attachments, but it might be the latissimus dorsi muscle in really any possible chunk, because it is a very wide muscle. It's also another reason why we can look at shoulder problems where we, say, can't fully lift the arm up and see it not as a shoulder problem, but as a scapular and scapular attachment problem. As always, it's best to work all the way around the bone to make sense of it. Yes, that was for one singular visual pun. You're welcome.